at the forefront of healthcare and usually the first point of contact for those with concerns or in need of information and reliable advice. Services are still being provided, which means that pharmacists and pharmacy workers are being exposed daily to potentially infected patients. Due to this, pharmacies have implemented social distancing measures. Pharmacy workers are wearing PPE and are protected by backpack screens.
In many hospitals, clinical trials to tackle COVID-19 have started, and during these times, pharmacists are playing a role in pharmacovigilance and also monitoring treatment outcome.
Pharmacists, in hand with all healthcare in interprofessional teams, are actively working in fields. Together, we will conquer COVID-19.
As with all healthcare fields, the veterinary profession has been greatly impacted by the COVID-19 pandemic. Many veterinary practices have moved towards seeing solely emergency cases, focusing on providing essential care for animals and protecting the food supply chain. More and more practices have been adopting phone appointments and telemedicine techniques to abide by social distancing protocols. The broader and vital role of the veterinarian as a public health ambassador has been emphasized during this pandemic. Veterinary equipment, such as ventilators, have been donated to local human hospitals to aid in the care of COVID patients, and veterinary facilities and staff also donate their time and equipment to run COVID diagnostics. Veterinarians are public health ambassadors with relevant and specific training in zoonotic diseases, and this expertise emphasizes the profession's vital role in the interdisciplinary cooperation toward not only controlling the current pandemic, but preventing the next one.
Dental practice has always been one of the fields with the highest risk of contamination. That's why infection control is a golden standard. Wearing full scrubs, head caps, masks and gloves has been a very normal and daily procedure. But the COVID-19 spread was a plot twist. This virus is transmitted throughout aerosols, which are very common in dental procedures, not to mention the direct contact with saliva and the very close distance between the dentist and the patient's respiratory airways, increasing infection risks. Thus, extreme care should be taken. Patient triage is mandatory during this pandemic. During this period, aerosol-generating procedures should be avoided for suspected patients. Proper cleaning and disinfecting techniques should be done after every patient, time gap between appointments to avoid patients' interaction in the waiting room, and many more measures can help in decreasing the coronavirus spread.
However, in March 2020, regulators and public health authorities recommended that all dental offices restrict their appointment to emergency cases only. The situation is still the same in some countries, and in others, dentists are back to their clinics with 30% capacity, with extreme measurements and full PPE in order to protect themselves and their patients. As for students, universities are still closed, so there is no clinical practice, but online lectures are the core of this semester continuation. Students are also gaining knowledge through different webinars like the one held by IADS, so that they stay in touch and updated on different levels.
I'm Ivan Say, SCOME Regional Assistant for Europe, and I'm a last year medical student in Belgium. So in Belgium, all elective consultations, surgeries, hospitalizations were suspended during the outbreak in the past weeks. For the students whose internship was suspended and there was no possibility to go elsewhere, they could volunteer in what we call the covered villages. So basically the population, or general practitioners, doctors, depending on the phase of the outbreak, were allowed to come and get tested at the entrance of hospitals. And so we had medical students as well as nurses and doctors do the sampling.
This is my house, where I have been living alone in the past 2 months as a final year medical student working in the front line and staying away from my family. This is the situation of so many medical students and doctors who are spending most of their lives in hospitals, especially with the lack of health workforce in many countries. Medical students and doctors today are working in hospitals, treating patients, surveilling them and checking up on cases. Our doctors and medical students today, with the huge workload, non-ending working hours and stressful working conditions, also face a huge burden on their mental health. Today, COVID-19 has showed us the importance of investing in healthcare systems and the urgency of investing, supporting, and caring about the health workforce.